You had a good summer? I had a great summer. Good. Yeah. You look 100%. Yeah.
Good morning, everyone, and welcome to the House Committee on Health and Human Services and Elderly Affairs. We have 13 bills that we're going to be working on this morning in a work session. And I know there's one or two folks here that want to speak to at least a couple of them. And we have an executive session scheduled for this afternoon where we're hoping to make some recommendations on these 13 bills. In the meantime, however, I'd like you to please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone. We're going to go a little bit out of order this morning. We have a number of folks here, and we think we'll deviate from the schedule a little bit and start off with HB 1067. And I believe Lindsay Taylor Jackson, you wanted to speak?
I don't think I need time.
Representative Weber.
I'm just going to say, as a preliminary matter, that it is unusual for people to come and testify in a work session. So this is not our normal practice. So
Sure, I understand. Good morning.
Good morning.
Can you push the button so that your microphone turns on?
Good morning. I'm Lindsay Taylor Jackson, and I'm making a film following people with endometriosis, and I'm here to tell my personal story today. I once was a happy kid who had friends, was athletic, and loved going to school. At 10 years old, it all changed. I began experiencing pain so intense it felt like a serrated knife was slicing and twisting through my abdomen. For the next 13 years, despite endless tests and doctor's appointments, I remained undiagnosed. I had excessive absences from school. At 23, I got my first surgery and diagnosis, endometriosis and signs pointing to possible adenomyosis. I began a medical journey of hell for the next several years. I spent a majority of my 20s into my 30s bleeding out 24/7, 365 days a year. My extra large overnight pads soaked through within an hour. I needed to frequent ER visits to make sure nothing was rupturing. Each visit came with fears of, would I need a blood transfusion? Could this be fatal? Multiple doctors shot me down for a hysterectomy because of my age and being in childbearing years. I was once told, I've seen women change their minds. You'll be depressed one day when you inevitably change your mind and want children. How could doctors allow their personal opinions of procreation into their operating rooms? I did what I could to survive. I was the cinematographer on a film about women thru hikers on the Appalachian Trail in 2016. I was supposed to film the entire 2,000-mile trail, but could only hike 630 miles with 50 pounds on my back because I was bleeding out and blacking out from the pain and blood loss the entire time. I left to go get another 2 surgeries. The nonstop bleeding and excruciating pain cost me countless work opportunities and career advances over the years. I got to a point where I couldn't even stand up most days. I slept 20 hours a day and army crawled my way to the bathroom. The pain was blinding, the nonstop blood loss was dizzying, and the depression was severe. In the years that followed, I tried harsh medications. Medications I found out later were not actual treatments, but were experimental band-aids that I fear were only aimed to preserve my uterus. These medications have left permanent physical damage. I never had a choice and was so desperate for any relief and was refused a hysterectomy time and time again. I made it clear for every doctor that I have always known I do not want kids. I've never wanted children. Physically, I wanted any disease out of my body and wanted to stop bleeding 24/7. I tried drugs with intense side effects over almost a decade that depleted my finances. I had to take out my entire 401k. I also had to accept endless financial help from my parents. I gave up my dreams of going to grad school, as there was no way I could afford the future I had always envisioned when I was being forced to plan for a future I had never even wanted. When I was 31, I found a surgeon who listened to my story. She validated that none of the choices made for me should have been anyone's but mine. She gave me a total hysterectomy and gave me my life and my dignity back. These choices need to be more accessible. I am in front of you as a citizen who suffered greatly within our failing systems. I am hopeful that by telling you my story today, you can at least understand what many of us have faced while deciding what your future laws dictate and when considering bills like this. Everyone should be able to define what their own quality of life looks like. Thank you.
Thank you. Are you taking questions, or does the committee have any questions? I'm seeing none. Thank you. Okay, thank you. Also, Maggie Collins has requested to speak. And again, we are limiting our comments to 3 minutes.
Mr. Chairman, again, I'm going to just say this is not a public hearing.
Sure, no, I understand.
My understanding was that the sponsor was going to speak, and that was it.
Well, Representative Reed is actually the sponsor, I believe. So. Representative Weber, do you?
It's your call. And
Okay.
It's very unusual to have a
Sure.
repeat of a public hearing. And if we are to do that for every bill that we have today, that's going to
Yeah.
make it a long.
No, that is not my intent, but okay, yeah, please. Yeah, hit the button so the red comes on.
All right, thank you. My name is Maggie Collins. I was born and raised in New Hampshire. I always knew I did not want children. I suffered from endometriosis that started affecting my life as soon as I entered puberty. I'm not sure if you folks are aware, but at the time that I went to Concord High School, they had a rule where if you miss 13 classes in a semester, you have to repeat that grade. My grade averages were in the 90s, but I missed more than 13 classes because my menstrual cycle would make me vomit uncontrollably for 2 or 3 days every single month. The only solution I was offered was opiates and ibuprofen. I was just told to take more ibuprofen. Now at 51, I can't take ibuprofen because it wrecked my stomach. I suffered for years. I did end up getting my GED and I was able to complete college because of online classes that I could attend when I could attend them. I went on to have a great career, but I was stymied in my career based on the fact that I had to miss work 1 or 2 days every single month unless my period fell on a weekend. And it's not just pain that I could power through or take medication to solve. I would vomit uncontrollably, and you can't go to work if you're vomiting all day long. This is a problem that women face all the time. I was not offered any solutions. Maybe they didn't have good ones back then, but they do today. People can get hysterectomies. We shouldn't be required to keep organs that are holding us back and destroying our lives just in case someday we want to have children. I'm 51 years old. I never had children because I didn't want children. I've never regretted this. I'm not sad or depressed. I don't have kids. I'm a little resentful that I was held back in my schooling and my career because I had a disease that would affect my fertility to treat, and some future hypothetical man or child was more important than me, who was living my life every single day. So this is an issue that does need to be addressed, regardless of what people think.
Okay,
And that's
thank
all.
you.
Thank you.
Thank you very much. Okay, since we are on this bill, we may as well continue to discuss it. Committee members, any input you have on HB 1067 for the work session this morning? Representative Leon.
Thank you, Mr. Chairman. I think that the bill was definitely narrowed down a lot from how it was initially introduced, because the bill, as we had it and we retained a study, was to allow for just a choice, sterilization or hysterectomy, and then also when there's a medical treatment and it's just being denied, medical treatment is being denied because of the expectation of future wishes. I do think that looking forward, it probably will be more convincing to people to simply look at when somebody is dealing with debilitating side effects, and no, it's not the medical side that's being prioritized, but potential future or emotional that may be a more effective way in order to make sure that women are not denied care. I do want to note as well that this bill was placed into the Patient's Bill of Rights. We all thought that would be a good position for that. However, we've come to learn that deals with facilities and not for healthcare in general. So that may be an issue for the future as well. However, I do want to thank you for sharing your stories, and I'm sorry that you had those stories that you need to share. I wish you could have had treatment sooner. So thank you.
Thank you, Representative Leon. Other comments from committee members, other thoughts? Representative Popovich-Miller.
Thank you. I'll be very brief since I'm a guest for the day, but I'm also a co-sponsor on this, and I appreciate all the work the committee put into exploring the different things that we need to do to make this better. And, I hope that it will have a positive recommendation, but either way, the bill is coming back, and looking forward to that debate next cycle. Thank you.
Thank you. Any other comments from committee members on this bill? Okay, I'm seeing none. All right, if there's no further comments from committee members, let's go back to the top of the list to HB 554 FN. Representative Nagel, you have done a lot of work on this. You've chaired the subcommittee on this. Had some very productive meetings, and thank you for your work. And please share it with us.
Thank you, Mr. Chairman. Thanks for those kind words, but I'm going to deflect them all to Representative Lundgren, who's brought up this bill in various forms over the years, so I think a lot of credit goes to him. Just as a background, the bill there was an opioid crisis. Prescription drugs had something to do with that, and that one of the reasons why there was an opioid crisis was because we failed to provide access to alternative treatments. There's a long reason, we need to go into a great discussion about that, but the whole point of this bill was to increase access to alternative therapies. It's been presented at least 4 times. This bill kind of got merged into a bill that I wrote, and it created kind of a major flaw that we really needed to fix, and that's why we put this interim study. We had 2 great meetings on this bill. And interestingly, the most important presentation during the entire time, I thought, came from Representative Murphy and Representative Dolan separately. Representative Dolan was representing Representative Lundgren initially, and he just basically gave us a story and told us why this bill was important, and that really kind of accelerated the value of what we were doing. Representative Murphy, when we had our first discussion, we actually did this as a discussion with stakeholders, and Representative Murphy talked to them and asked them why not, and that also accelerated the discussion to make us feel why this was important to keep going. So we ended up voting on it 6-0. We also actually did work to 6-0 to proceed, and we actually started working on the new bill as part of that process. So it was great to be part of this, and thank you.
Thank you. I know some of the others here were on that subcommittee. I know Representative Weber, you were, Representative Murphy, were you on the subcommittee? Have you wanted to speak on this at all, or?
Thank you. I'm happy to speak on it. And I think that Representative Nagel did a great job of shepherding cats through a somewhat difficult problem. I think we all recognized in the practice of medicine that there was an opioid crisis, and we have made substantial steps in the last 20 years to improve upon that. My hesitation always has been to legislate, the practice of medicine. Having said that, there are also many safeguards in place at the current time which deal with, continuing medical education, board recertification, et cetera, to maintain that people are aware of the opioid crisis. But my other plea was to make sure that in this discussion that the insurance companies are keenly aware of and are involved in the decisions that we make going forward. So I think that there would be many things that were in the bill that were initially, I thought, should not be part of the demands or the mandates for insurance companies or practitioners, meaning things like making sure that you have enough practitioners and facilities in an area. I mean, that's almost impossible to do. So some of that stuff will have to be vetted out. But having said that, my two major concerns were, and I won't be here in the next legislative session to help shepherd this through, though I may be sitting on that side of the aisle when this bill comes forward. I think that it would be very important that we do not legislate the practice of medicine, in any bill that we put forward, but also that when we do so, that all stakeholders, including insurance carriers, are part of the discussion and part of the solution going forward. Otherwise, I think it's doomed to failure. So I think that we came across, we did a lot to establish the fact that this bill should probably go forward, but that it should be vetted in a way that makes sense for all the stakeholders involved. Thank you.
Thank you. Representative Nagel?
Thanks. You said all the greatest things. And I just wanted to say that I was really honored with how many people were involved in this process, including the insurers who came to our meetings, and that was wonderful. And I also did want to say to the people in yellow that what we're talking about has some value for you too, we hope, because I've heard your story way too many times, and it's very sad. But thanks.
Thank you. Representative Weber, did you want to speak at all on this? I know you're on the subcommittee.
This may have been the subcommittee that I could never figure out whether I was on or not, but I certainly agree with everything that's been said so far, so I'll leave it there. It's certainly an issue that needs to be looked at continuously going forward.
Thank you. Anyone else? Okay, seeing no one else with a comment on this, let's move on to HB 580FN. I've been remiss in announcing what the purpose of each bill was. HB 580FN is establishing a child's vision screening initiative within the state Medicaid program. Any thoughts by committee members on this? Representative Weber.
Well, I'm thinking that maybe Representative Shapiro may have some thoughts on it as well, but I think it's a very worthwhile initiative, and I think we ought to explore it further in time to come. Because the issue of children's vision and appropriate early intervention is an important one. So I would suggest we ought to recommend it for further legislation.
Okay. Representative Shapiro, I don't know if you're quite settled in yet, but did you have any thoughts on this bill? Okay. Okay, well, yeah, it's 580 about the Children's Vision Screening Initiative, but obviously we'll be addressing that further this afternoon in the executive session. So if you want to speak then. Okay, great. Anyone else? Moving on to HB 608FN, establishing a pilot program to support the Bureau of Developmental Services redesign. I had heard that there might be one or two people who wanted to speak to that. I don't know if they still do. Anyone in the audience? Seeing no one? Committee members, thoughts? Representative Weber.
I'll just ask for my memory to be refreshed. Is this not something that's been partially dealt with, at least by the department going in a different direction for the design? And therefore, we've kind of moved on from where we were. And I think one of the reasons that we were holding on to this was to see where they went with their new direction. But it seems to me that for this one, the time may have come and gone, and there may be new filings based on current progress, but that this one perhaps is not.
There is a provision in the
Vehicle.
bill that has a deadline of June 30th, 2024. I did speak with the department on Associate Commissioner Santinello on Monday, and the department has been addressing many of the aspects of this, and they don't think it's necessary at this point. So you're absolutely correct.
And may I add?
Sure.
My recollection is that this was one of a set of 3 or 4 different bills that were filed at a time when recipients of services and families were particularly distressed at the directions that might be going in service providers. And so I want to be sure that we acknowledge that what we need to do going forward is a more collaborative effort. But I think that perhaps as a result of the filing of all of these bills, that point was made loud and clear. So.
Thank you. Representative Leon.
Thank you, Mr. Chairman. This bill was introduced at the beginning of the term at a time of great uncertainty regarding the redesign of the Bureau of Developmental Services. It was retained by the committee to continue the discussion, which happened in the spring of 2023 and the fall of 2023 on this issue. There was a lot of good discussion that did bring stakeholders together and had a chance to speak about this publicly and move towards a solution. With that, we had recommended interim study to keep this alive so that it could continue as a forum if it was needed. Now we've moved forward, we've moved past that. This has served its purpose, and this bill is not needed for future legislation because it's already done its job. But I'm thankful for the committee for keeping it an interim study because it did keep that forum alive.
Anyone else? Representative Murphy.
Thank you, Mr. Chairman. Mine is mostly a question. As I wrote down in our notes, on March 13th, we actually voted with Representative Leon, making the motion to retain the bill. And this was to keep it, quote, as I wrote it down, to keep it moving, but to have HHS oversight, potentially have a follow-up with a committee to evaluate. And my question is mostly, or my comment is mostly a question as to where do we stand right now, and will HHS oversight put forward a committee to recommend or look at this bill, or this, where do we stand with this is what I'm asking.
Representative Leon.
Thank you, Mr. Chairman. Thank you for that question. When we had put this together, we were hoping that we'd be able to work on it as an interim study during the term. However, we had to wait until all the other bills were dealt with in order to meet as an interim study. By that time, speaking with area agencies and speaking with others, they felt that the process was moving along. They had a good collaborative relationship. They do have to report to Health and Human Services oversight. That's an ongoing issue, but I don't think that it's at the level of needing a committee. And I trust those on oversight to make that committee at this point if it's necessary. Thank you.
Other comments or questions? Seeing none, okay. Moving on to HB 1010, relative to expanding maternity options in midwifery access. Any thoughts? Representative Nagel.
Thanks, Mr. Chairman. One of the terms that I have learned in 2 years that I have never heard before was this concept of scope creep. And it's viewed as a negative thing, and in some circles and a positive thing in other circles. As a middle child born on a Wednesday, I kind of look at it from the middle. I think in certain circumstances it can be a great thing. And what that basically means is that different medical people decide to take more responsibility within their scope of practice. Like, for example, I do epidural injections. I've done 64,000 of them. When I started, that was not in my scope of practice. That was an anesthesia thing, but now I do it. This is one of those things. We've had 4 bills in our session now where there was a scope of practice issue. One was the optometry bill, one was the physician's assistant bill, one was this bill, and then there was a physical therapy bill. I have absolutely no problem with people asking for the right to do more if they do their due diligence to develop the skill level that they can to be able to do it. For the physical therapists, they did that. For the other 3, they have not. And when I presented this bill to people that work with midwives on a regular basis, I got a deer in the headlights look, like, no, 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 no. They said they don't have the skill level to do this. And one of the things that I'm very aware of, having been involved in 4 obstetrical emergencies, 2 with my own children, is that things can go from bad to worse really fast. And they said that whenever a midwife has to do a delivery on a child of the type that's specified in this bill, that they have to make sure that they have extra resources available in the OR, whether the midwife knows it or not. They have to do that because they don't have the ability to deal with those emergencies. And that's why I don't support this in any way, shape, or form. I don't know midwifery well enough to know what kind of skill level they need to get to be able to do these things. But in this group of patients that's specified in this bill, I have a problem with that. And so I won't be supporting it.
Thank you. Representative Shapiro.
Yes, having been present at my daughter's breech vaginal birth, this is kind of close to my heart. It was in a hospital with a doctor with decades of experience. My main problem with this bill is that my understanding is it's the Midwifery Council that is tasked with overseeing the scope of practice for lay midwives. And then we're proposing a bill that tells the Midwifery Council what they can do and what they can't do when they are the ones that are tasked with deciding on the scope of practice. So it seems contradictory to me. So I'm not in favor of moving this bill forward.
Okay, thank you. Representative Murphy.
Thank you, Mr. Chairman. I guess part of the process this morning will be to re-stimulate some of our memories of what happened back in the springtime. We looked at this bill, and I specifically asked the Midwifery Council, would they support the bill, and they said absolutely not. Number two, I also put in again, regarding the whole concept of practice scope, creep, et cetera, et cetera. I'm not sure I understand it fully, but having said that and been a practitioner for many years, if you were to change the midwife title in the analysis section of this bill and just put it as their experienced physician with decades of experience, they would still not, support the bill as written. So for those reasons, and because there's no experience, OBGYN that will deliver a, multi-pair, multiple fetuses within a uterus, breech presentation, 30 miles away from home, et cetera, et cetera. So if you were to basically substitute the word midwife and put experienced physician with decades of experience, they would still not vote for this bill. So I would vote against it unless it's been changed substantially. Thank you.
Thank you. Representative King and then Representative Leon.
Question for the chair. Was this a bill that was actually worked on over the summer? Were there any subcommittee hearings on this? Or, because so far it sounds like we've basically heard objections that we would get during executive session. And it'd be nice, unfortunately, Representative Cushman's not here. I imagine she would have been on that subcommittee. I don't know. I just would like a more work session out of this as opposed to just.
Sure. To answer your question, no, it was not worked on over the summer. We had done a number of surveys. Our committee assistant had done a number of surveys, and there wasn't the interest from committee members to work on it. So nothing was done on it. And we do have to make a decision, though, ideally today, in terms of recommending or not recommending. But to answer your question, no, nothing was done over the summer. Representative Leon.
Thank you, Mr. Chairman. Representative Shapiro, I'm so glad your daughter was able to have that type of delivery as opposed to being required to have a cesarean section to deliver her child. In 2019, when I was temporarily in the position of breech, I was speaking to my hospital and the others available. And because of legal concerns, they no longer they would only do a cesarean. Even when they had training because of legal concerns, because the actuaries were too worried about the what ifs, you were not permitted to have a vaginal breech birth in New Hampshire in the hospitals, at least the ones that I spoke to that were close enough to my home. With this, you are leaving women the option of either consenting to the surgery, maybe if they're already a tried and tested mother with a team that's comfortable of doing this, you're denying her that opportunity, or you're asking her to free birth and then show to the hospital if there's a consequence, or to go out of state, because in Massachusetts this can be done. I know that the bill as written had some serious questions for a lot of people, but I do think that we're not just talking about what we can have the practice of the past where you had doctors who were experienced in vaginal breech deliveries, because those don't happen in hospitals anymore. We're now looking at the fact that those simply are cesareans, if that is a presentation. And and I believe in people being able to have more agency in their choices. So I do think that we do need to have a discussion, because you're not talking about women who are going to be going to the hospital. You also have women who will be free birthing because they can't have an experienced attendant. So it's an issue that we need to talk about because of moms and babies, and the fact that as we've had a more and more concentrated healthcare system, there's a lot of times when the lawyer's in the room with the doctor. It's not just the doctor and the patient. But I appreciate your concerns, because there's a reason why we make sure we have such a robust system. In the past, we lost too many moms and babies. We're trying to minimize that, but we need to acknowledge that nothing is riskless. So thank you. And I see the way that the things are going on this one, but I did want to make the point that without permitting that, you're asking a woman to go out of state unless she wants to consent to surgery to deliver her child.
Representative Nagel and then Representative Shapiro.
This is more a question for those way more experienced than I am on what we're doing today, but I don't think there's a bill here that we're looking at that doesn't have some amount of merit, that could probably be made better, that we could probably do better with study or whatever, recommend something in the future. I'm trying to understand what we're trying to accomplish here.
Representative Weber.
Well, traditionally, the responses have been all over the lot to interim study, because we interim study bills for a whole bunch of different reasons. And it sounds to me like we have one. I mean, sometimes we keep them to see what's going to happen. We think there's been a resolution to a problem. We're not sure that the resolution's going to work. We keep them around to work on, and see if, in case we need them. That's one. And we've already had one where it sounded like our discussion was heading in that direction today. It's clearly a bill whose time has come and gone. There other things where I think reasonable parties disagree as to what our mission is, even, because this is not a time for us to come up with an actual bill going forward. That can only be done by the next legislature. And so it's really giving our sense as to how far we've gotten in a discussion of what might come up. And I know there's a bill coming up for at some point where there has been significant more discussion, and we can talk about that, and actual progress on wordsmithing. But again, that has to happen next time. So in many ways, it's a matter of wordsmithing a report. I mean, I have actually written a report that says that everybody on the committee agreed that further action was needed. We were completely opposed as to what that action should be. And I wrote the two opposing positions. So you come out all kinds of different ways. And certainly, no matter what the vote is, I would assume that there is more than room in the writing of the report to acknowledge an underlying problem. And, what we think ought to be done with it is only interesting because it's for the next legislature to determine.
Representative Shapiro.
I actually have a lot of mixed feelings about this bill, because I do feel like patients should have choice, and including taking more risks, because it's something that's really important to them. I don't necessarily think we should give the right of providers to provide services that is overly risky. So I have mixed feelings about it. I'm going to rely on Representative Murphy, who seems to take notes and actually can find his notes about these things. But my memory is that and this is not to contradict you, Representative Leon, but my memory is that when we had this discussion, we had this hearing, and when medical providers testified, that they said that it was possible to get a vaginal breech delivery in New Hampshire. Now, it might not be at every hospital, and it might not be. There might be problems with that. Like the doctor who actually does that might be on vacation or something, but that it wasn't impossible. but anyway, I just, that's just a memory that, that I had that I wanted to bring forth.
Representative Papavici Mueller.
Again, as a latecomer and a one-day visitor, all I want to say is that I appreciate learning about what was done earlier, but I would not consider it wasn't impossible to be reasonable, a reasonable option for patients. If we give them options, they have to be options that are reasonably feasible, not, if you jump through 15 hoops, maybe you'll get lucky and get that. I know that's not what you meant, but when you talk about standards, right, what is the standard that we use? That's a very important discussion. And I would think we need something better than it's not completely impossible. That's all. Thank you. And I know that was not your intent to go there, but.
Representative Leon and then Representative Murphy.
Thank you, Mr. Chairman. One of the things that we do is we try not to confront witnesses or necessarily ask questions that aren't getting us to a solution and simply are to try and ferret out what's going on. I believe that the provider who said that they happened at their hospital was at the same hospital where I was denied that option. So it's one of those areas where it's hard to say, well, I disagree because of facts and my facts contradict what somebody is coming to testify for us. But in that scenario, I believe that provider was at the same facility that told me that that was not an option. So we're here trying to deal with people and information that we have, and that's why it's a challenging job. But I appreciate that.
Representative Murphy.
Thank you. Thank you, Mr. Chairman. Only in response to Representative Shapiro's question, we did have that conversation with the practitioners, and they also did say that there are multiple options available for having cesarean or having vaginal deliveries with breech presentations and multi-period, multiple fetuses within the uterus. The idea that having a delivery is an emergency is not true. I mean, oftentimes it is, and oftentimes it comes without warning, and you have to deal with it as you have to deal with it. But the majority of the time, people have the option of where they can call up a hospital and say, "Will so and so be able to deliver this? I would love to have this vaginally." And they'll say, "Yes, we have the experience to do this." So yes, the answer to your question was yes, that there was available services in the state of New Hampshire.
Other comment, Representative King.
I have a question for everybody, actually. I just reread the bill, and I think I may have misunderstood it when it was first presented several months ago, and I don't know why. Maybe my memory is fuzzy, but my understanding was that the bill made sure that women always have access or options to midwives. But as I'm rereading it, it almost sounds like this would kind of force hospitals to allow midwives to work within the hospital system. Can somebody just explain to me in layman's terms what this bill does?
Representative Leon.
Thank you, Mr. Chairman. This is around what the midwives are able to do. If they're required to deny care or if they're required to transfer care of a woman because her condition has gone beyond the scope, that's what it deals with. It's not talking about requiring the hospitals to permit them to come and practice. It's simply about whether or not that midwife can continue to provide care for that woman.
Okay, thank you. Then my understanding was correct originally, and which is why I support the bill, because to me it just seems weird that in this state you have the legal ability to terminate a pregnancy, but you wouldn't have the ability to use a midwife when you want to. That seems highly incongruous. Thank you.
Representative Nagel and then Representative Shapiro.
And again, tell me if I'm wrong, but to me, this is totally a scope of practice bill. It allows them to deliver certain types of deliveries in certain settings that they may or may not be qualified to do, and setting them up for, consequences for that. And in the end, we all pay for. So that's the way I read this bill, as a scope of practice bill.
Representative Shapiro.
I'm glad to be corrected, but if I'm not mistaken, there are two levels of midwifery certification. One is a nurse midwife who may have the ability to practice in a hospital and deliver babies in a hospital. The certification of midwives that we're talking about, and I know they're not referred to as lay midwives, but I don't know the proper terminology. But we're talking about people who would generally or only be delivering babies outside of hospitals, I believe.
Representative Leon?
Yes, the certified nurse midwives are the ones that practice in the hospitals. Those are the ones where they're on staff in some of our hospitals. The certified midwives is the title we have for it here in New Hampshire. You have different degree requirements, and they're the ones who are helping women all around the state, especially as we're closing our deliveries.
But they do not practice in hospitals.
Correct. They do not
Right.
practice in hospitals.
Representative Murphy?
I would just like to clarify again what I think is the rule that is written in the analysis here, and it basically says a midwifery council, which governs the oversight, just like the Board of Medicine or the, generates evaluations of our practices in general. It says the midwifery council shall not adopt rules limiting care. So what there really is the scope of practice, restriction, basically saying that the midwifery council will not be able to put into place rules that protect the fetus and the baby and the mother, in certain circumstances that are listed here, including, presentation, number of, prior C-sections, distance from a hospital, et cetera. So it is a scope of practice, bill.
Representative King?
Thank you for that clarification, Representative Murphy. Can you tell me who created the Midwifery Council? Because if it was created by an act of legislation, then ultimately the authority still rests with us. I don't know.
Representative Murphy?
I do not know.
Okay. Any other comments on HB 1060, HB 1010, I'm sorry. Any other comments? Seeing none, okay. Moving on to HB 1347, relative to administration of the New Hampshire Refugee Resettlement Program. Any thoughts on that? Yes, Representative Weber.
I have to say frankly that I thought that this was a very inadvisable bill when it was filed. And the provisions in it that said that until all of the social determinants of health are satisfied for every single citizen, that we would not expend funds for immigrants was particularly inadvised. And if I recall correctly, the sponsor came to us and said that he had filed it in a moment where he perhaps was not paying quite as much attention to what was in front of us or what was drafted, that he, as all of us, have concerns about immigration and how we relate to the immigrant community, and that perhaps we ought to think about it some more. It seemed to me that this was a particularly inappropriate vehicle to do that thinking. So I would suggest that it not be referred for further legislation along these lines, although I am quite certain that the issue broadly is one that will come up regularly going forward. But I frankly thought that this as drafted, which may, and I'm not attributing motive, but as drafted, it seemed to me to be particularly mean-minded, and I take the sponsor at his word that it was not what he was intending.
Sure. Representative Leon and then Representative Shapiro.
Thank you, Mr. Chairman. Within the language of the bill, there was reference to wait lists. I think that a lot of this was looking at the number of people who have unmet needs, who are waiting for services that the state has said that they'll provide if they have the money. So it was looking to take those state funds. There's so many complex interactions between the federal funding agreements and state law that the bill is completely unworkable. And even taking a seed of looking at dealing with the wait lists, it's going to, anything to deal with that would have to take such a different form that I would suggest that we not recommend this for future legislation.
Representative Shapiro.
Yes, thank you, Mr. Chairman. As much as I personally would love to see the legislature be involved in some kind of really broad, fair-minded discussion about the effects of immigration in New Hampshire and the benefits and the problems, I don't, in my personal conversations with Representative Edwards, I think that he also wanted to have, maybe for different reasons than myself, have a discussion about immigration because it's such a big issue in our country. And so I would agree with Representative Weber that he had already rethought this particular bill when he brought it. And it was particularly flawed because the Department of Refugee Resettlement within DHHS, which is very small and helps to coordinate with the private nonprofit resettlement agencies that work in New Hampshire. The department within the Department of Health and Human Services is very small, is completely, I believe, one staff member and limited funds, and it's completely federal funds. So the bill was referring to state funds, and I think the sponsor realized that it wasn't really relevant, and I would agree that it's not really relevant. So if there's some kind of bill on immigration that comes forward next session, I don't think it would really be related to this specific bill. So I would agree with the other people who've spoke that we should not recommend it go forward.
Thank you. Representative Murphy.
Thank you, Mr. Chairman. I couldn't agree more with Representative Leon and Representative Shapiro as well, that having some bill regarding immigration would be great, but this is not the bill nor the platform on which it should be established. And I have the quote that was taken back in March by Representative Edwards. I really don't like this bill. I doubt we could ever amend this bill in any way, in any acceptable manner. So I think the prime sponsor was one who basically felt the same way, that even with amendments, we were not going to make it a good enough bill to address the issues of immigration that you speak of. Thank you.
Thank you. Other comments on HB 1347? I'm seeing none. Okay, moving on to HB 1661 FN relative to immunization reporting requirements. Any thoughts on that? Representative Shapiro.
Yes, thank you, Mr. Chairman. I see a number of problems with this bill. As I understand it, this bill would require certificates of death which might be signed off on by a medical examiner, but most likely would be signed off on a physician, a hospitalist, or a family doctor, whoever is dealing with the person who's at the end of their life. It would add the requirement that a history of vaccinations be included in that death certificate. I just think that is way beyond the scope of what the normal person, the normal physician who's signing off on these generally does, and it would create an incredible burden of having to go back in history and find all that information and write it. So that's one problem I have with it. Another problem is that it calls for DHHS to do quarterly reports that aggregate all this information and to try to find connections between the history of vaccinations and those deaths. So that is, I don't believe the bill calls for hiring more staff for DHHS or money for maybe the technology that would be needed to do this. But that is also seems to me to be an incredibly large requirement that we would be putting on DHHS. The last issue that I have with this bill is the last part of the bill, which suggests a lottery to pick 4 different auditors to audit this information. And I think, well, in short, I think that just opens us up for, breaches of confidentiality, and it's kind of goes against the trend in our state that people really, really want to protect privacy. So for all those reasons, I do not think this is a good bill for us to pursue.
Thank you. Representative Weber.
Thank you, Mr. Chair, and I won't reiterate all of what Representative Shapiro said, but I agree with all of it. The other couple of points that I thought of is that when my husband died at home, his hospice nurse did the certification. So that's a whole nother range of people who will have had no contact with the vaccination status of people, in most cases at least. And the other concern I had, and I'm sorry, I don't have the bill in front of me, and I've managed to leave my laptop at home, so I was going to whip it up and give you the site, but there was language about those reports that had particularly squishy language about reporting as appropriate and as consistent with privacy. And I am sure that in this room, in our discussions among our committee members, it's become very clear that my notion of personal privacy and my personal privacy is not the same as other members in this room, and we should each get to define that for ourselves. So I thought that language was squishy and unhelpful and provided very little guidance as to how sensitive stuff was going to be dealt with. Also seems like the folks who presented were able from Massachusetts data to match up information and names, which seemed to me to be particularly intrusive. And then the final point that I would like to make is if we want usable data that's going to help us make determinations about outcomes, here we have no control really about the quality of what's being reported, because on the one hand, we have people who have authorized the reporting to an optional registry. We have people who have exercised their right not to be included in a registry. And we have people who have exercised their right not to take a vaccination. And there's no way of knowing who those people are and so that we can evaluate the outcomes appropriately, because some of the people who have no reporting will have no reporting because they didn't get a vaccine, and some will have no reporting because they didn't want to report. And that results in data that is not going to be particularly useful if we're looking at correlation, which is really all we can look at. We're not looking at causation here. So thank you.
Thank you. Representative Murphy and then Representative Leon.
Thank you, Mr. Chairman. As I reviewed the bill once again, I found that there were multiple issues that concerned me as well, including the privacy issues. But, it goes beyond that in many ways. It becomes a burdensome issue for many practitioners. The list of people that can actually as Representative Weber mentioned, the list of people that can certify a death are fairly long. They have to be available to certify the death within 36 hours. And in doing so, they also have to have the computer information in which to look up the database and then assess whether or not the patient had an immunization. My other concern is that why immunization? Why not, do we not look at things like, did they have a total joint in place? Do they have what were the medication lists? So the list can go on and on and on. But the death certificate should simply state that the patient died and the patient died this date and the patient died because of this reason. You want to try to keep it as simple as possible. The KISS principle in medicine has held up for many decades, and I would try to do the same thing here as well. So I cannot support this bill unless it was changed dramatically over the summertime. Thank you.
Representative Leon.
Thank you, Mr. Chairman. And thank you, Representative Murphy, for actually bringing up a very good point about the general idea of some of the benefit that could come from a better look post-death, given the complexities. There are some areas where it may make sense to have some sort of comprehensive review about not only what has been prescribed, but what's been taken. If you've been prescribed certain antipsychotics, you're not taking them, and then a very bad thing happens, that may be an important public health interest. I do think that it would behoove us to look at how to have a more comprehensive look around medical decisions and then people's outcome, either their death or death that they've caused for others. But I agree that there's a lot about this bill that was not workable and that brought a lot of challenges. I do want to highlight to Representative Weber, I benefited a lot from data that came from the Swedish registry that is a lot more comprehensive than anything we would have here, because in Sweden they have one healthcare system and your data goes in, you don't have a choice. But even with that, there were areas where there wasn't complete information, so you couldn't analyze every single person in that group. So even if you had some people who had to be excluded from an analysis because you were not certain about their status, there's ways statistically to deal with that. But I recognize that there's a lot of structural issues with the bill. And I guess we'll see where we move on in the afternoon, but there's no reason to belabor the point at this point. So thank you.
Other comments? Saying none, let's move on to the next one, which is 1663 FN, which is relative to the confidentiality of medical records and patient information. Representative Leon.
Thank you, Mr. Chairman. This bill sought to provide protections and clarity regarding medical record confidentiality through a repeal and replace method. A substantial amount of the testimony that we heard opposing the bill was actually opposing existing parts of current law. So I would recommend to myself, if I introduce this in the future, to not do a repeal and replace, but to have all the changes within there so we can discuss the actual changes to law instead of getting lost in trying to tease out the differences. So there is a need to assess New Hampshire's protections of patient privacy in a more rigorous manner, especially given the increased knowledge around HIPAA. A lot of people thought that it was all about privacy, but in reality, it's about portability and making sure that providers, insurance companies, in some cases, people advertising for different causes, have access to your medical record within an ecosystem that is policed to some manner and some level. Federal law does allow us to make state laws more protective of personal privacy. And I think that given how often privacy comes up in this committee and in other parts within the state, it does make sense to look at it in the future, although I will agree that there were things that I could have done better on this bill. So hopefully we can recommend it for future legislation, but I know it will look different than the way that I introduced it.
Other comments? Representative Nagel.
Thank you, Mr. Chairman. Yeah, that's really helpful, and I appreciate all the points that you raise. It seems to me, just looking at the people that responded to this, virtually all the responses I saw were kind of negative. Mostly because, I've been involved in healthcare now for about 40 years, and I've watched the healthcare system change dramatically, where there's more and more oversight. We spend more and more time dealing with paperwork and computers and less time with patients, and that kind of really screws up the way we practice healthcare. And a lot of them saw this as doing that, which I think you raise a valid point. That's a problem. To me, like, the way I like to deal with these things is like an ad hoc multi-stakeholder group. This is a problem. How do we fix it? How do we solve it without making your life miserable? And as a doctor, I would kind of appreciate that kind of format to dealing with this, and then coming up with legislation that respects everybody's needs and wishes and because I just think we've been harming healthcare too much the last 30 years.
Representative Weber.
Thank you, and I thank you both for your comments because there's a lot that I agree with in both of them. I think that this, for me personally, is an example of one where I think the report writing is going to be delicate. I think I would tend to vote that this bill, this approach is not something that I think should go forward, but we've already had that acknowledgement on the approach. And that I think that the report should acknowledge that both privacy and functionality for practitioners and privacy for patients and functionality for practitioners are things of concern to everyone. So insofar as that is an ongoing conversation, I think we're probably all in agreement that we're going to be having that conversation in many formats. But I think my vote would be that this is not the bill to have that conversation on. So coming to different conclusions for roughly the same reasons, which is odd, but.
Other comments, Representative Murphy?
So mine is mostly a question for the primary sponsor of the bill. Am I to understand you that you would not want to go forward with this bill and amendment, but come up with a separate legislation, entirely separate from this one going forward in the next legislation?
Well, thank you for that. If we were to move forward, somebody would need to take that to OLS and draft the language. For one, I would not do it as a repeal and replace. And for the second, I would take a lot of the testimony that we heard in order to balance the privacy and the functionality. Because the last thing I want to do is add more bureaucracy and red tape to a system that is already nearly strangled by that. But I also want to make sure that we're balancing the different needs that we have. I don't have one in drafting for the coming year, but there may be one in the second year, and that would only be if I work with an ad hoc group. But I would rather not sort of snuff out the light on this because this did have bipartisan sponsorship, and so that we could move forward and work together to make sure that we're protecting privacy and just rebuilding. So much trust has been lost in all systems, government, everything. We need to rebuild that, because if we can't rebuild trust on a whole, we're going to lose the society that we have, and that would be a shame. But part of that comes with respecting privacy and respecting the ability for doctors and other practitioners to do their job without too much red tape. So I think that it's something that if we have the bandwidth, if we had the ability, it would greatly benefit the people of New Hampshire. But it would need to be a large effort where we get together lots of stakeholders, work hard over a summer, not necessarily through this process, and then bring some language to the legislature that's been more fully vetted, because this touches everybody. And sometimes it touches you as both a provider and a patient.
Other questions, other comments? Representative Nagel, you have your microphone on.
Oh, sorry.
Is that an indication you want to speak?
Sorry, I was just going to say amen.
Okay. Anyone else? Okay. Seeing no one else, let's move on to HB 1693, which is relative to the use of psychedelics for therapeutic purposes. Representative Leon.
Thank you, Mr. Chairman. I just can't get myself out of the healthcare world. I get the Mudscape news updates all the time, and I can't tell you how many times I've heard something about a JAMA article comparing psychedelics to existing antidepressants. And when I've seen that this is something that's moving forward in medicine. Right now, the VA is doing some research on it. Mass General Hospital has a treatment center, and they have some facilities here in New Hampshire. But right now, New Hampshire law prohibits a clinical trial from happening in the state with psychedelics because of its status as a controlled substance. I think that having to send patients out of state to participate in this, especially if they're dealing with something like PTSD or end-of-life fears, I think that we should move forward with a much, much, much narrower process in order to make sure that we're not interfering with the clinical trial process in a highly supervised environment. However, the idea of trying to set up an entire alternate ATC program for psychedelics is unworkable. That's something that I had hoped to discuss with the prime sponsor and move forward. However, he did not attend the hearing. And I don't want patients who could benefit from what the FDA has designated as a breakthrough therapy to suffer simply because there wasn't the effort to work on language to revise his bill as opposed to come back in the future with one that would enable clinical trials.
Representative Weber.
And I would just say that I agree with absolutely everything you just said, that I think the place for the trials is within the medical community and under strict supervision. But if the medical community needs the tools for us to be able to do it, we should be helping them so that anything that shows promise as a treatment option can be appropriately evaluated and moved forward as it is shown to be useful. So thank you for that.
Representative Nagel.
Thank you, Mr. Chairman. I guess that gets me back to the pragmatics of this, because I don't support this bill as written, but I support everything you just said. Is that like, well, vote yes, we want to look at further legislation, or say, no, I want you to come up with something totally different next time?
Representative Leon.
So part of it is, if you could agree with this as the committee report statement, New Hampshire state law currently prevents research and/or treatments which use psychedelic drugs despite the expanding research into this area. The Veterans Administration and Massachusetts General Hospital are currently conducting research for a number of disorders, and the FDA has granted breakthrough therapy designation for some psychedelics. We recommend future legislation to permit patients access to clinical trials or other therapy without the need to cross state lines for care. I could add language to say in a supervised medical one. But that is my intent of the language. So a lot of this does come down to how we split hairs about the recommended for future legislation. But I think that if we narrow the funnel and say what we think was good about a bill, I think that's helpful for future legislators.
A question of another person here.
Sure, go ahead.
Representative Murphy, sorry. Do you guys do ketamine infusions at Dartmouth? Because that's a psychedelic functionally, and that, we used to have patients go to Germany to get that.
Ketamine infusions for
Pain,
I don't know that for sure. I know that we use ketamine in the OR, but I don't know that it's used as a treatment option. It would be better asked of somebody from DH.
I'm just curious,
I don't
because
know
if
that
we're
for sure.
already doing a psychedelic, this is.
I left DH about quite a few years ago, so I'm not sure if they do that right now. They might.
Do you want to speak? Representative Weber.
I was just going to say in partial answer to your earlier question that certainly if that's the way the report's going to be written and it's recommended for further action, I certainly would vote for it. I think the devil's in the meat of the recommendation is in how you write the report. And that seems to me to encapsulate all the concerns that I had and put out very clearly what might be the scope of future action. So,
Representative McKay.
Thank you, Mr. Chairman. Could somebody define psychedelic? Because I don't know what that means.
Representative Leon is looking up the definition.
So some of the drugs that are being researched for use for within these are psilocybin, which is from the mushrooms, MDMA, which is called ecstasy. That one I believe is for I believe it's both for PTSD. I know that it's also for end-of-life concerns and fears when people are suffering debilitating fears. There's been a significant amount of research on it, but a lot of this is looking to use some of these I guess some are lab created, some are more naturally derived. But within the scope of this law, it would be looking to be a clinical trial that's been approved from an IRB, most likely. Although I'm not sure exactly how tight we want to get on this because we don't want to tie the hands. But the intention would be for a clinical trial. And I know psilocybin and MDMA both have breakthrough status designation at the FDA.
Thank you.
Representative Nagel.
I just wanted to point out something interesting because this is my clinical experience. But back in 1990, there was a gentleman that published a study looking at illicit drug trade in New York City, and he identified two different groups of drug dealers. One were the people that dealt with it for you to get high. The other ones that were dealing drugs to help you treat a symptom. They called themselves street doctors, and they were totally illegal. The reason they were doing it is because of the HMO flourishing in that time frame. People couldn't get the drugs they needed. What I've seen in my world that I'm a little bit silent about is that there's experimentation going on these drugs every day, and a substantial percentage of the patients that I see all the time. There would be certainly a benefit to having oversight of that from, a medical provider. That's really not happening, and that's really why what you said is really important. So,
Representative Weber and then Representative Leon.
And just in further answer to Representative McKay's question, the word psychedelics for the purpose of this bill is defined specifically as any of the following substances: psilocybin, lysergic acid, diethylamide, LSD, and mescaline. And then there's a further definition of psilocybin, meaning anything that came from that particular fungus. So it is limited to three very specific things. But I think it still bears the issue of let's look at it carefully under controlled circumstances, and if we're standing in the way of that, we ought to figure out how to quietly and with the least amount of intervention get out of the way of progress.
Representative Leon.
Thank you, Mr. Chairman. Thank you for bringing up ketamine. Ketamine is a Schedule III drug, just like buprenorphine and anabolic steroids. So those can be prescribed, and that's not against New Hampshire law. Schedule II, which is raw opium, oxycodone, cocaine, and fentanyl, those are all can be prescribed within certain scenarios. But all of the drugs within this are in Schedule I, which they're deemed as having no medical use, and that's why New Hampshire law would need to carve out the ability for these particular Schedule I drugs to be used, and that's why it's an issue, and that's why we're in the way, potentially.
Representative Shapiro.
Thank you. I would certainly be happy to vote yes on Representative Leon's language. I actually feel that a broader expansion and legalization would be appropriate than just clinical trials. But I can't imagine that happening. I mean, it just seems like it's such an enormous amount of work that would have to go into it. And we've seen from the attempts to legalize recreational marijuana, how, the way every element of a bill has to be considered and parsed. And so it seems like any broader expansion of psychedelics would be enormous amount of work that I don't see anybody working on in the legislature. I mean, there was this bill, but it was just basically saying we should legalize all these things. And so I think the language that you used would be a very good first step. It would allow certain things to happen in state that then people could consider into the future. Thank you.
Okay. Anyone else? Okay, moving on to the next bill, HB 1706 FN, relative to notice required prior to circumcision procedure. Anyone have any comments or thoughts on that? Wow. Oh, sure. Go ahead, Representative Nagel.
Please. I had a big problem with the bill as it is. I saw it as a slippery slope that would dictate an informed consent for one specific issue when we deal with hundreds of thousands of different medical issues and procedures and interventions and things like that. With that said, the bill brought up the important issue of informed consent that I think is in our medical legal world right now is significantly flawed. It ceases to use as a format to inform patients of what they're getting into, but merely as a means of covering risk benefit. And for the provider, having had to rewrite about 10 informed consents last year that our risk management department made me do, and when I saw the outcome of them, I was really appalled because they didn't inform the patient of anything. So I did think that this brought up an incredibly important issue. And if we frame the report in terms of that and not the specific issue of circumcision, then I'm very supportive of this. If it's the circumcision issue specifically, I can't support that.
Representative Papa-G. Muller.
Commenting as a patient, and God knows at my age, I'm a patient here and there. I have not seen a informed consent process which I felt was meaningful in a long time. You go there, they give you the little black box and they tell you the name of the form you are signing, you don't see it. Sure, you could ask for it if you are willing to disrupt their process because they have 5 more people waiting. I understand part of why the process evolved this way is that we do create all that red tape and the practices have to be able to streamline their operations and they meet the law in the best way they can. So I'm not, assuming any ill intent, but I would welcome again a more nuanced discussion on informed consent that would make it meaningful without hamstringing medical service providers. And I'm in no way saying this bill is the way to do it, but I think the issue in general deserves more attention lately. Thank you.
Representative Murphy.
Thank you, Mr. Chairman. I think this is basically what Representative Nagel was getting at, and also what you were talking about as well, is that it's hard for me to have a bill go forward by legislators that deals with a specific procedure, i.e. circumcision. So, parents make informed consents for their kids all the time, up until the age of 21. They make informed decisions for them. So, my question is not specifically for any future legislation to be that specific, but to be more generalized with informed consent. Informed consent is, I would say, in my experience, gone the way of the dodo, the way of the Edsel. I think that we oftentimes do not inform our patients well enough. For instance, to get a informed consent on the day of surgery, to me, is not informed consent. I mean, you could say to a patient, I'm going to take your arm off and put it on your toe, and they'll say, sure, I'll sign right here. That just does not work. So informed consent to me is a much broader issue. I don't and cannot support a bill that is so specific regarding circumcisions, just like I couldn't be more specific about any other, medication or treatment that we provide between a parent and a child. So to me, any future legislation I would hope would have to do with more the informed consent versus the specifics of a procedure. Thank you.
Representative Shapiro.
Yes. I would hope that we recommend that this not be brought for further legislation. I absolutely understand that informed consent is an issue, and I cannot fathom the fact that it won't be brought up in other legislation coming up. But this bill, in my mind, people are probably sick of hearing me talk about this. I'm sick of hearing me talk about this. This bill, in my mind, while I understand the issue of people feel like they came to the situation where their child was going to be circumcised or not without adequate information, and there should be more education, I support that completely. But in my mind, the bill itself that was brought and the testimony we heard was so one-sided and was really about people telling other people what they should do and what they shouldn't do. And I don't think it's I don't think it's the state's business to tell people what they should do and what they shouldn't do. I should take that back. That's in this regard, I don't think the state has any place in pressuring people to make decisions one way or the other about circumcision. And so I just felt like the whole motivation that this was brought with was offensive, really offensive to me. And so I'm certainly going to vote that this bill should not be brought forward in any way.
Representative Leon.
Thank you. Do you mind if I ask that you apologize for attributing motive on that? I know that I recognize you working through that, but giving a motive to that is one of the things that we don't do. And I know we've had really good discussions on this sort of thing before. I just saying that, giving the motive in which you had offered it, I think is just a little bit past where we should be. But I respect everything else that you said. You almost became a libertarian there too.
Representative Weber.
I heard it as describing a perception rather than ascribing a motive.
Okay, then I guess I'll withdraw that. I just wanted to make sure we kept everything on really good and friendly terms because we've done such a good job of that.
Representative Nagel.
Thank you, Mr. Chair. I think that this gets me back to the pragmatic issue. We had an absolutely wonderful discussion on this issue between this bill and also another bill that Representative Cushman brought up about the whole concept of informed consent, and it really touched a nerve with me. And one of the things that I think that I said at the time was that this is an issue that really warrants further, I hate to do this because everybody hates it when you say this, but further multi-stakeholder study on some level that we can actually look at this issue, because I don't think informed consent works at all right now. And I think it's important that we look at that. Is that a yes or a no? Or does it get back to how do we write up the report? Because I would write it up the way I said it earlier if I wrote it.
Okay. Is that a general question?
Yeah, anybody, you guys are way smarter than me.
Oh, I'm not sure about, in my case, I'm not sure about that, but any other thoughts on Representative Nagel's question or position? Representative King.
Thank you. Representative Shapiro brings up an interesting topic, and that is the fact that it was so one-sided during testimony. And to me, it seems like the silence is deafening. Why, if I may ask the representative, why do you think there was no strong lobby or concerned citizens or really anybody that came out against the bill? Why do you think there was, I mean, if this was really a bad idea, why didn't anybody come in and articulate that in testimony? Thank you. For Shapiro, Representative Shapiro.
Representative Shapiro.
I'm still kind of mulling over Representative Leon's question of me and figuring out how to answer that. But I'll speak for myself. You know, I'm somebody who's 74 years old. When I'm Jewish, so maybe that had something to do with why I was circumcised, but also my age, almost all men were being circumcised in the United States. A lot of the testimony involved people talking about being damaged by circumcision, having PTSD from circumcision, having a rupture with their parents because their parents were the ones that made the decision to circumcise them. We heard talk about people being mutated people having not having satisfactory sex lives because they were circumcised. So as one particular example, those things, I didn't have any of those experiences. So I think the vast majority of people who have had the experience of circumcision, and I'm not saying it should happen or it shouldn't happen. If I was a young parent now, I don't know that I would circumcise a male child. But I think the vast majority of people who've had that procedure, it just has not been a problem in their lives. So, there was not an outpouring of people coming out in defense of circumcision. It's just a non-issue for most people, for most men, I think. My perception.
Representative Nadel.
You really touched a nerve for me. This is the problem I have with the legislative process and why I like ad hoc groups, is that it's a you snooze, you lose type thing. If you're not aware that this is going on, you're not coming here. They came here with an organized group of a really organized group of people. There's not an organized group of people out there that says, I love circumcision, with t-shirts and whatever, it doesn't exist. And so most people weren't even aware this ability even existed. Like when we do ad hoc groups, what we do is we look at, we look at who's not here and who needs to be here so that we have a balanced discussion on an issue. And that frequently I think doesn't happen here. And that's why I like that kind of group to solve these problems.
Representative McKay.
Thank you, Mr. Chairman. I have to admit that I was going to ask a question about motivation. And I do have some concerns about why we're only asking questions about circumcision. But I won't ask that question. Thank you, Mr. Chairman.
Thank you. Other comments? Seeing none, let's move on to SB 400, relative to patient access to medical records. Any thoughts? Seeing none? Okay, moving on to SB 458, relative to the dispensing of certain medications. Any thoughts on that one? No? Okay. And finally, and I know Representative McLean had chaired a subcommittee on this final one, SB 495, relative to certification of alcohol and other drug use treatment facilities. I know we had at least one subcommittee meeting. I sat in on it. Unfortunately, he can't be with us this morning. He will be here this afternoon for the executive session. Representative Shapiro.
Yes, Representative Weber and myself participated in those subcommittees, and I think, can tell me if I've got this wrong, but I think there was, a general consensus that there was a usefulness that would come out of certification of certain substance use disorder programs that are currently not overseen by by DHHS in any way. And I think those we kind of narrowed. When we first had the hearing, it was very confusing about what kind of facilities we were talking about, what kind of programs we were talking about. And in fact, the news reports that had stirred us to bring this bill happened in a residential program, and there already is oversight over residential programs, so it was very confusing. But I think in our subcommittee work, we decided that it would be useful to have some level of certification of, I think they were broadly called outpatient substance use disorder programs, which includes day treatment, intensive day treatment programs such as this. And Representative McLean was pursuing getting more specific language written, but we agreed to vote on suggesting that this bill be approved for further legislation before we saw the specific language. So I think it was the consensus of the group that it was a good idea to recommend further legislation.
Representative Weber.
And I would agree with all of that. And I think that this is an example of one where we did actually make some progress in the drafting. It wasn't ready to go. And of course, it has to be, as we have noted, introduced in the next legislature. But the bill as it came to us had significant drafting issues in it, and we had significant issues of understanding exactly what the aims were and what it was going to cover. And in this case, I think we came to a considerable amount more clarity. The other part of the discussion, and I'm sorry that Representative Merchant couldn't be with us today, but he's otherwise engaged, was that there was the issue of certification of staff members versus certification of a facility. And the concerns that we had were, if you only rely on the certification of staff members, it's possible that the staff members go down the line, but the facility hires somebody else and the problem occurs again and again and again because the facility has a particular bent that is perhaps not as appropriate. And the concern, I think, for all of us is that the people who are being treated at these facilities are at a particular vulnerable spot in their lives. And we want to be sure that the care that they are getting is optimal. So,
Representative Shapiro.
I think in the end, in the initial hearings that we had in this committee, there was some discussion about the facility itself, like the building. And I think we kind of narrowed in on, we're not talking about the licensed clinicians because there's already oversight over them. And we're not talking about the facility necessarily, but we're really talking about the program. And we did not want to kind of have oversight narrow the scope of the program because we know there's a lot of different views on what makes a good substance use disorder program. There's all kinds of models that have been used, some of them now discredited, but certainly there's not full agreement about what the right way is to treat someone with a substance use disorder. So we wanted when this eventually happens to allow for innovation and allow for variation, but to have some oversight on efficacy. And efficacy and ethical considerations within that program.
Thank you.
And can I just say one more thing?
Sure.
Which is I want to give Representative McLean, even though he's not here, my appreciation for pursuing this because it's kind of a dry subject, and I think he had mixed feelings. I think he didn't feel so positive about it. But then some people, his constituencies, thought it was a needed idea, and he really did a very, very good job of chairing the committee and gathering information and encouraging people to come to talk about it. So I give him a lot of credit.
Thank you. Other comments, other thoughts? Okay, I'm seeing none. All right, that concludes all of the bills that we're going to be considering this afternoon. Any final thoughts? Oh, yes, Representative Murphy.
Just a question, maybe a request. When we meet this afternoon to exec these bills at 1 o'clock, is it possible to have, in Representative Shapiro's comments made me think of this, were any of the bills acted upon during the summertime? Was there a subcommittee? Was there a recommendation? If so, what was it? At the beginning, so that we can table set at the very beginning of every discussion that they did or did not have a subcommittee meeting, and if so, what were the outcomes? What were the recommendations made at the time?
Sure, there are only two functioning subcommittees. Again, that was on HB 554FN and SB 495, unfortunately.
Okay, and that's what I thought, because that's what I heard, but I was part of 554. I don't know if I was a true member or I just kind of sat in and made. I don't know. Whatever. I know what the recommendations out of that were and what the changes were. So I appreciate that. Those are the only two that
And
had.
people wanted
a-
to enjoy their summer. They didn't want to be doing this stuff. So.
Gotcha. I understand that. Thank you.
Any other thoughts? Any other final comments before we, oh yes, Representative McKay.
Thank you, Mr. Chairman. This may be the last time this committee meets, I'm thinking. And I just wanted to comment on the individuals who decided not to come back. And I'm very appreciative of those who decided to come back. But it's going to be a great loss to this committee for some of the people who become close friends over the session. So I just wanted to comment, and I'm kind of looking at the ones that are extremely important to me, and wanted to thank them for what they have done and encourage them. As one of them said, I may be over there. That's not a threat. That's a wonderful thing that people can do. And Joe is one of the last social workers left, so I'm hoping that we can replace that person. But I felt it was very important, having served on this committee for a very long time, that this is one of the best committees. And I want to thank the chair for his fairness and reliability as well. Thank you very much.
Thank you, Representative McKay. Anyone else? Any other final comments? Okay, why don't we, at this point, I'm going to declare a recess until 1 p.m. Good afternoon, everyone, and welcome back to the House Committee on Health and Human Services and Elderly Affairs. We had a work session this morning and went over all 13 of our bills to be considered this afternoon. And at this time, we're going to enter executive session to make recommendations as to future, either to recommend or not recommend for future legislation. With that, I'd like to open it up and start with House Bill 554 FN. Do I have a motion? Representative Murphy.
Thank you, Mr. Chairman. I recommend for future legislation for House Bill 554.
Representative Murphy recommends moves that 554 be recommended for future legislation. Is there a second? Okay, Representative McKay beat you to it. Representative Nagel. Any discussion on this motion? Representative Murphy, do you wish to speak to your motion?
We spent, as one of the only two bills that had work sessions this summer, we spent two fairly long sessions led by the able Representative Nagel, and we made some recommendations, and one of the biggest recommendations was that we go forward with future legislation with some of the caveats that we discussed earlier this morning. So I would recommend that we recommend for future legislation going forward.
Any other discussion? Representative McKay, did you want to speak to your second, or are you all set?
I'm all set.
Okay. Any other discussion? Seeing none, I'll ask that the clerk call the roll.
You're not going to trick me by asking your name first at the top here. So, Representative Leon,
Yes.
substituting for Representative Cushman is Representative Lynn.
Yes.
Representative Kofalt.
Yes.
Representative McLean.
Yes.
Representative Seth King.
Yes.
Representative Lisa Mazur.
Yes.
Representative Nagel.
Yes.
Substituting for, and I won't say this every time, but this is the only time that I will say it. Substituting for Representative Polozov is Representative Popovici Muller.
Yes.
Representative Weber.
Yes.
Representative McKay.
Yes.
Representative Nutter Upham.
Yeah.
Representative Murphy, yes. Representative Tellez.
Yes.
And Representative McDonald.
Yes.
Did I miss anybody? Representative Shapiro, yes.
Yes.
Yes. Sorry, I skipped right over you. I think that is everybody in this convoluted chart. 1, 2, 3. The yeas have 14, the nays none. 14 to 0.
14 to 0.
Yep. Maybe the chairman?
Did you vote?
No, I voted.
Did you vote, Jack?
Representative Murphy voted, yes. Representative Nutter Upham, did you vote?
I did.
Okay.
I did.
Well,
Kept an eye on him, yes.
who is missing here? Yes. Your vote. 15 to nothing.
I want to thank Representative Murphy for filling in for Representative King, our clerk.
Not doing a very good job
No,
right
it's
now.
not an easy job. I've done it. But thank you for doing this.
Okay.
All committee reports, the deadline, the absolute deadline is October 25th. Obviously, the sooner the better, so that, as I'm sure there's always some last minute reports, so the sooner that you can get any of these in, the better. Representative Nagel? You're probably the best suited, unless Representative Murphy objects.
I don't object.
Okay. Yeah, if you could write that one, that would be great. Okay, next up is HB 580 FN, establishing a children's vision screening initiative within the state Medicaid program. Do I have a motion?
I'll make the motion.
Representative Weber.
I would move recommended for further legislation.
Representative Weber recommends for future legislation. Is there a second? Representative Shapiro seconds. Representative Weber, do you want to speak to your motion?
I simply think that an ounce of prevention is worth a pound of cure, that setting up a program and getting it instituted so kids get checked early and interventions, if needed, are started early is always a good thing and tends to save a significant amount of dollars in the long run, as well as changing people's lives. So,
Thank you. Any other discussion? Representative Leon.
Thank you, Mr. Chairman. I would like to note that the reason this went to interim study is because there still were many, many things that were uncertain given the language of this bill. And my question is whether or not this is recommending sort of notionally of this general idea for future legislation, or to build it as a model off of this, this existing bill.
I would definitely say that it was the former. It was the concept rather than having this bill be the model.
Okay, so I'm trying to figure out where I am. Okay, thank you.
Other discussion? Representative Leon.
Yes, the largest part within this is some of those details do matter to me a lot. If we're looking at setting up more clinics within our schools, we're bringing more and more opportunities where we're sort of blending the education mission with the healthcare mission. I know there's been a larger move towards that, and there's so many different open-ended questions that, while I agree that that we need to make sure that children can see and that there's a method to do so, the process of expecting everything to fall within the Medicaid program or within the school program, there's some fundamental questions I have with how to execute that. And while I support all children being able to see and getting the vision care they need, even the direction of doing this through Medicaid and tying it to school attendance raises significant concerns to me. So while I support all children being able to see, even moving forward off of this notional one presents problems to me.
Other discussion? Seeing none, I'll ask the clerk to call the roll.
Representative Leon.
No.
Representative Lynn.
No.
Representative Kofalt.
No.
Representative McLean.
No.
Representative Seth King.
No.
Representative Nagel.
No.
Representative Popovici Moeller.
No.
Am I pronouncing it correctly?
Yes, no. Don't try to make me vote yes, okay?
Is that a no?
It's a no on every question. I'm kidding.
Representative Weber.
Yes.
Representative McKay.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro.
Yes.
Representative Murphy, yes. Representative Tellez.
Now I'm confused. Yes.
And Representative McDonald.
No.
And you missed me.
And Representative,
Mazer.
where is it listed? Oh, yes, Representative Mazer. Sorry.
No,
I thought I checked your no, but I did not. I did this.
I didn't say it, but
1, 2, 3, 4, 5, 6, 7, 8. Okay.
And now we will need the opposite motion.
Okay.
1, 2, 3.
Is it a tie?
No, nope. 96. Nays. 9 nays. 6 yes.
So the motion
Yes.
fails 6-9.
All right, it's my understanding, Kristen, that we now need to take the other vote, right? Okay.
I'll move not recommended for future legislation.
And Representative Leon moves not to recommend. Is there a second? Representative Mazur seconds. Any other discussion? Seeing none, when the clerk is ready.
Okay. Representative Leon.
Yes.
Representative Lynn,
Yes.
Representative Kofalt,
Yes.
Representative McLean,
Yes.
Representative Seth King,
Yes.
Representative Mazur,
Yes.
Representative Nagel, Representative Popovici Muller,
Yes on the motion, yes on the name.
Representative Weber,
No.
Representative McKay,
No.
Representative Nutter Upham,
No.
Representative Shapiro,
No.
Representative Murphy, no. Representative Telez,
No.
Representative McDonald,
Yes.
nine to six. Recommended, not for future recommendation.
I'll write that.
Okay, now it's only do we need two reports on that or just one?
We're not allowed two reports.
No,
There's
it's,
just one.
so it'll just be Representative Leon's
Yeah.
report? Okay. Okay, next up is House Bill 608 FN, establishing a pilot program to support the Bureau of Developmental Services redesign. Representative Leon.
Thank you, Mr. Chairman. I move not recommended for future legislation.
And second.
And Representative Weber seconds. Do either of you wish to speak to your motions?
I'll speak briefly.
Sure.
Thank you. This bill was introduced during a time of great uncertainty regarding the redesign of the Bureau for Developmental Services. It was retained by the committee to continue the discussion surrounding the implementation of the redesign, and we met both in the spring and fall of 2023. Stakeholders were able to come together, and while we recommended this for an interim study to keep the forum alive, it was not needed. The process worked, and future legislation is not needed.
Any other discussion? Okay, I'm seeing none.
Ready?
When the clerk is ready, I'll call the roll, please.
On House Bill 608, recommendation is not for future study. Representative Leon,
Yes.
Representative Lynn,
Yes.
Representative Kofalt,
Yes.
Representative Mark McLean,
Yes.
Representative Seth King,
Yes.
Representative Mazur,
Yes.
Representative Nagel,
Yes.
Representative Popovici Muller,
Yes.
Representative Weber,
Yes.
Representative McKay,
Yes.
Representative Nutter Upham, Representative Shapiro,
Yes.
Representative Murphy, yes. Representative Telez,
Yes.
Representative McDonald,
Yes.
The vote is 15-0 in favor of not recommended for future legislation.
Okay, thank you.
Mhm.
And moving on to House Bill 1010, relative to expanding maternity options in midwifery access. Do I have a motion? Representative Leon,
I'll move recommended for future legislation.
is there a second? Representative Kofalt. Representative Kofalt seconds the motion. To recommend for future legislation, do you wish to speak to your motion?
Yes, thank you. This bill sought to remove barriers to midwives attending home births by setting some guardrails on what and what wasn't permitted within the administrative rules surrounding the scope of practice for midwives. I think further discussion needs to happen in order to balance the risks and the opportunities. However, we do need to recognize that we're looking at the potential of having more and more unattended home births if we're not able to accommodate mothers whose wishes cannot be accommodated either with a certified midwife or in the hospital setting, and where they may be going out of state to neighboring states like Massachusetts, where some of these are permitted by their equivalent of certified midwives. While I recognize that there were various concerns about the implementation and how it was done, that's why we would leave to a future legislature how better to accommodate the risk preferences of different parents.
Other discussion? Representative Shapiro.
Yes, thank you. Well, I think there's merit in providing as many options as possible for people to decide on their own risk tolerance. And while I also think that there are merits to the arguments from a lot of the more medically oriented people on this committee that these might be very unsafe. For me, the determining factor is really that in legislation we are saying that the Midwifery Council, which is the very council that is tasked with providing the scope of practice, then we are turning around and telling them what they can do and what they can't do. And so for that reason alone, I would vote against recommending it for future legislation.
Other discussion? Okay, other discussion? Okay, Mr. Clerk, I'm sorry, Representative King.
Thank you, Mr. Chair. To address Representative Shapiro's concerns, I think that councils like the Midwifery Council, they know that they're in a tough position because on the one hand, they want to promote midwifery, they believe in the practice, but they also know that if anything bad happens, that it's going to look bad for them, and it could result in negative legislation against midwifery. So they're maybe in a position where they feel they have to be more conservative than they otherwise would be. I think if they had their druthers, they'd probably support the provisions in this legislation, but they can't do it themselves because of the consequences that could come from it. Whereas we, the legislative branch, who has the ultimate authority over these councils and ultimately the law, we can let's just say be less conservative. So that's to address your concern. For me, the reason why I'm supporting this is because I just find it to be incongruous, as I said in the work session, that people have a legal authority to terminate intentionally a pregnancy, but to not have access to midwifery. That doesn't make any sense to me whatsoever. And then last, I'm a California refugee, and when I moved to the state of New Hampshire, I met a lady who was also from California, and she was a midwife, and she was a felon because she was in the room. She wasn't the one delivering the baby, but she was in the room, and during the process, she touched the baby, and that was enough to make her a felon in the state of California. So I don't know what the penalties would be in New Hampshire, but we have a situation where a person could be giving birth outside of a hospital, and somebody who's just a random person not involved with midwifery would potentially have the legal ability to help deliver that baby, but somebody who's professionally a midwife might not have the legal ability to deliver that baby. That also doesn't make any sense. So to me, I like the idea of decriminalizing people from doing something that our ancestors have done for thousands of years without legal repercussions. So we need to end the war on midwifery. Thank you.
Representative Nagel.
I just wanted to point out that I believe there's substantially better ways to address the obstetrical crisis in this state than this.
Thank you. Other discussion? Seeing none, I'll ask the clerk to call the roll.
Motion before us is recommendation for future legislation on House Bill 1010. Representative Leung.
Yes.
Representative Lynn.
Yes.
Representative Kofalt.
Yes.
Representative McLean.
Yes.
Representative Seth King.
Yes.
Representative Mazur.
Yes.
Representative Nagel. Representative Popovici Muller.
Yes.
Representative Weber.
No.
Representative McKay.
No.
Representative Nutter Upham.
No.
Representative Shapiro.
No.
Representative Murphy. No. Representative Telez,
No.
and Representative McDonald.
Yes.
Eight to seven for in
Recommend.
favor of future legislation.
Okay, thank you. Okay, next up is House Bill 1067 relative to a patient's right to sterilization treatment. Do I have a motion? Representative Leon?
Sure. I move recommended for future legislation.
Is there a second? Representative Popovich and Muller, seconds. Representative Land, do you wish to speak to your motion?
Yes, thank you, Mr. Chairman. This bill sought to remove barriers to sterilization treatment for consenting adults and to provide protection for those who provide this treatment. Of note are women with debilitating endometriosis or other conditions who are denied the standard treatment of hysterectomy because of physician concern about their future reproductive wishes. Additionally, through this bill and others, it's become apparent that the Patient's Bill of Rights in RSA 151 only applies to care in certain healthcare facilities in the state and not into patient rights in general. So future legislation should place patient protections, including the access to sterilization treatment, in a different section of law.
Other discussion, Representative Weber.
Thank you, Mr. Chairman. My concern with this legislation is the way it was drafted. But my other concern is the stories that we heard of people who went through very, very difficult and life-altering lack of the care that they believed they needed and that was proved later on to be helpful to them. I have my concern with the bill was all the particulars about how we were going to effectuate this. If there was something very limited which stated that the procedure could not be denied solely on the basis that a medical professional his opinion about what you might want later on in your life was better for you than what you thought was good for you. I would be much more favorably inclined towards such legislation. So for that reason, I've come down on the side of voting recommend, but I do have real reservations about the mechanisms contained in this bill.
Thank you. Other discussion, Representative Popovich Muller.
Thank you. I'm encouraged to hear the comments of my colleagues. In the previous few votes, we've made it clear that we don't necessarily support the legislation as written, but we support the intent with the understanding that future legislation may be written in such a way to address concerns expressed by this committee. So I would like to encourage, everyone to consider supporting this important bill. At the end of the day, it comes down to our agency and our ability to control what happens to our body. And I think that if we believe in freedom and the freedom to control what, is happening to us, this is a prime example of a bill that, deserves support. And again, I'm sure that every word in a bill matters, and it can be maybe made clearer that, the pre-procedure cannot be denied solely on the basis of that. I thought the language was already doing that, but I'm just one of 400. So I would appreciate everybody's support for this. Again, knowing that future legislation will have to go through a full legislative process. Thank you.
Other discussion? Seeing none, I'll ask the clerk to call the roll. The motion is
recommendation for future legislation on House Bill 1067. Representative Leon.
Yes.
Representative Lynn.
yes.
Representative Kofalt.
Yes.
Representative McLean.
Yes.
Representative Seth King.
Yes.
Representative Mazur.
Yes.
Representative Nagel.
No.
Representative Popovici Muller,
Yes.
Representative Weber,
Yes.
Representative McKay,
Yes.
Representative Nutter Upham, Representative Shapiro,
Yes.
Representative Murphy, no. Representative Telez,
No.
Representative McDonald,
Yes.
twelve to three.
Motion passes 12-3.
12-3.
Thank you. Next up is House Bill 1347, relative to administration of the New Hampshire Refugee Resettlement Program. Do I have a motion? Representative Shapiro.
I move that we not recommend for future legislation.
Representative Shapiro moves we do not recommend. Is there a second?
Second.
Representative Weber seconds. Would you like to speak to your motion, Representative Shapiro?
For one, we had a long discussion about this morning, but the prime sponsor acknowledged when he came to present the bill that this did not really meet his intentions in putting this bill forward. And secondarily, the program within the Department of Human Services that coordinates with private nonprofits, resettlement organizations, only works with a select, very select group of immigrants, which are refugees. And the money is provided for their staffing and for the limited amount of money that they're able to give out in terms of grants. It's all federal money. And the bill itself talked only about state funds. So it, I just think that it's irrelevant, and also that it didn't really meet the sponsor's intention in terms of having a broader discussion about the effects of immigration on our country. So I think that any other bill that's put forward would be so different from this bill that it would not really be related.
Thank you. Representative Tellez.
I just want to reiterate, having directed the office in which this program resides, as written, it is completely untenable. These federal funds are completely directed to one unique purpose, and the refugee program, all costs are completely federally funded, and there would be no way for it to be changed to other people, or again, as Representative Shapiro pointed out, there are no state funds involved, so untenable.
Thank you. Other discussion? Seeing none, I'll ask the clerk to call the roll. Motion is to not recommend.
Motion is not recommended for future legislation on House Bill 1347. Representative Leon.
Yes.
Representative Lynn.
Yes.
Representative Kofalt.
Yes.
Representative McLean.
Yes.
Representative Seth King.
No.
Representative Mazur.
Yes.
Representative Nagel. Representative Popovici Muller.
Yes.
Representative Weber.
Yes.
Representative McKay.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro.
Yes.
Representative Murphy. Yes. Representative Telez.
Yes.
Representative McDonald.
Yes.
Vote is 14-1 in favor of the recommendation.
That motion passes 14-1. Next up is House Bill 1661 FN, relative to immunization reporting requirements. Do I have a motion? Representative Kofalt.
I move to recommend for future legislation.
And Representative Mazur seconds the motion. Representative Copal, do you wish to speak to your motion?
Yes, the intent of the bill is, I believe, to see that data is available, given the very serious concerns that have been raised about the safety of certain vaccines, in particular the COVID vaccine, that data be made available such that it could be analyzed and better understood, that we could better understand the correlations between certain vaccinations and certain causes of death. Having said that, the bill as introduced was, I think, extraordinarily detailed and burdensome. It did not take a lightweight approach to providing this information. So I sort of understand the sentiment behind going interim study as opposed to moving the bill forward. Having said that, I think that if we indeed want to follow the science, we ought to have this kind of data available.
Representative Weber.
Thank you for that, and I appreciate the caveat that it ought to be done in a very different way. One of the conversations we had this morning was about whether we recommend or not recommend where the line comes between recommendation and not recommendation when we don't agree with the approach in the bill. This one, for me, crosses the line into not recommending, so I'm going to oppose the recommendation. The reasons are this. The data that you're collecting, first of all, it's collecting the data in the wrong forum because the number of people who certify deaths who would have to be incorporated into having access to the vaccine registry is burdensome, and it's burdensome of a procedure that happens at a time when collecting vaccine records is particularly inappropriate. In my case, my late husband died at home, and the hospice nurse certified the death. She would not have had any access to the vaccine data that's requested here. If you collect the data, however it's collected, as this requires, you have not 2 columns, but 3 columns. You have people whose data is in the registry and can be retrieved, however burdensome that is. Then you have people for whose death certificate has no data. But what you don't know is how many of those people for whom there is no data are people who were vaccinated but chose not to become part of the registry, as is their right, or how many of them are people who are not vaccinated, as is also their right. So I don't believe that when we look at this data, we're comparing apples to apples. We don't have any way of separating out in the no data column whether that means that they weren't vaccinated or they simply didn't want to be reported. And then there were the issues for Department of Health and Human Services in terms of the amount of extra work that was going to be for them. The other thing that was mentioned this morning that I will just note was that at a time when we are having medical professionals assume more and more and more clerical stuff and data collection stuff and hoops to jump through, this was one more hoop that perhaps came at a particularly inappropriate time, and done in an inappropriate way. So I'm coming down on the side of saying no to recommendation. So.
Thank you. Other discussion? Representative Nagel.
I've been going back and forth on the, thank you, Mr. Chairman. I've been going back and forth on this bill for a lot of reasons. The question that I was focusing a lot on this morning is, what is our role here? And you kind of addressed that again, but this is one bill that I really think that should have had a study group, and it should have really looked at this in detail and should have gotten testimony from the people that were going to be involved in collecting this data to find out how burdensome it was and it wasn't, and that was not done. And it was actually, when I looked at my notes, that was something that I had recommended when we actually heard this bill originally. because that information's not there, I have to say that to me it crosses the line too. I think the concept's good. I just think the way we collect the data and how we affect the practice of healthcare at a critical time has to be considered. And certainly what we're doing here is not changing that future legislation can't come, but what it is saying is it can't come in this format. And that's why I'm going to vote no.
Other discussion? Representative Tellez.
Yes, thank you. I would, to me, given my training, the desire for wanting to know if there's an association between certain diagnoses at time of death or causes of death and any historical vaccines that may have been administered is completely a historical or retrospective. You look at data sets. It's something you just do with a computer if you have access to the data, and you don't need to have the person who's certifying the death know anything about it. So how it was written is what makes it untenable. The idea that the person certifying the death would be the one who would review the records for immunization is completely unnecessary, and it's what makes it impossible. And the cost would be much more than what was written in the fiscal note, given the burden that it would impose. So, again, untenable.
Thank you. Other discussion? Seeing none, I'll call for the vote. Ask the clerk to call the roll. Motion is to recommend for future legislation on House Bill 1661 FM.
Representative Leon,
Yes.
Representative Lynn,
Yes.
Representative Kofalt,
Yes.
Representative McLean,
Yes.
Representative Seth King,
No.
Representative Mazur,
Yes.
Representative Nagel,
No.
Representative Popovici Muller,
Yes.
Representative Weber,
No.
Representative McKay,
No.
Representative Nuttarampam,
No.
Representative Shapiro,
No.
Representative Murphy, no. Representative Tellez,
No.
and Representative McDonald.
Yes.
Motion fails at 7-8.
Okay, motion fails from 7 to 8. Do I have another motion? Representative Weber.
I'll move not recommended for future legislation for all the reasons that we've also already stated. And also, I'm going to raise the issue of the fact that based on data from Massachusetts, we were given actual names associated with some of the data when we heard this the first time around. And I think the privacy issues in this format are simply a bridge too far. Although if I'm drafting a response, is it fair for me to put in that response that everybody on the committee is concerned about assembling appropriate data about vaccination and consequences of vaccination? It's just that for those of us in the majority, we don't believe it's this format.
Any objections to that? Yeah. Representative Murphy seconds the motion. Any other discussion? Seeing none, and the clerk is ready. Motion is to not to recommend 1661 for future legislation.
This involves another piece of paper.
Take your time.
Okay. Representative Leon,
Yes.
Representative Lynn,
Yes.
motion is not for recommendation of future listing.
Oh, yeah.
Sorry. Thank you. No.
Oh, I was confused.
No.
It's been a long day.
I'll stay with what you said initially.
I appreciate that. No, I'm going to change mine to no.
As long as it's
Thank
not
you.
before the
And I
vote
would
is
also-
called,
Sorry.
yeah.
Mr. Chair, I would also like to change mine to no.
And I beg deficiency in caffeine.
I should take the clerk's prerogative, but I will not. I will register your vote as intended. Representative Cobalt,
No.
Representative McLean,
No.
Representative Shetnik King,
Yes.
Representative Mazur,
No.
Representative Nagel, Representative Popovici Muller,
No.
Representative Weber,
Yes.
Representative McKay,
Yes.
Representative Nutter Upham,
Yes.
Representative Shapiro,
Yes.
Representative Murphy, yes. Representative Telez,
Yes.
Chair. The chair.
and Chair,
No.
Representative McDonald.
No.
That motion to not recommend for future legislation passes 8-7.
Motion passes 8-7. Not to recommend. Next up is HB 1663 FN, relative to the confidentiality of medical records and patient information. Representative Leon.
Thank you. I move recommended for future legislation.
Is there a second? Representative Mazur seconds. Do you wish to speak to your motion?
Yes, thank you. This bill sought to provide protections and clarity regarding medical record confidentiality through a repeal and replace method. Substantial testimony opposing facets of current law as overly restrictive suggested that there's significant need to assess New Hampshire's protections of patient privacy in a more rigorous manner, particularly given the expanded public awareness surrounding HIPAA. The Health Insurance Portability and Accountability Act was assumed to be a privacy protection law, when in reality it facilitates easier sharing of patient records. Federal law permits states to be more protective of patient privacy, and it is recommended that future legislation take into account views from multiple stakeholders before legislation is filed.
Any other discussion? I'm seeing none. When the clerk is ready, I'll ask him to call the roll. The motion is for recommended for future legislation on HB 1663 FN.
Representative Leon,
Yes.
Representative Lynn,
Yes.
Representative Cobalt,
Yes.
Representative McLean,
Absolutely, yes.
Representative King,
No.
Representative Mazur,
Yes.
Representative Nagel,
Yes.
Representative Popovici Muller,
Yes.
Representative Weber,
Yes.
Representative McKay,
No.
Representative Nutter Upham, Representative Shapiro,
Yes.
Representative Murphy, no. Representative Telez,
Yes.
Representative McDonald.
Yes.
Recommendation for future record legislation passes 11-4.
Motion passes 11-4 to recommend House Bill 1663 for future legislation. Next up is House Bill 1693 FN, relative to the use of psychedelics for therapeutic purposes. Representative Leon.
Thank you, Mr. Chairman. I recommend recommended for future legislation.
Was that for or not?
For,
Yes, for future
Okay.
legislation.
Yep.
is there a second? Representative Cobalt. Representative Leon, do you wish to speak to your motion?
Yes, thank you, Mr. Chairman. New Hampshire state law currently prevents research and/or treatments which use Schedule I psychedelic drugs, despite the expanding research into this area. The Veterans Administration and Massachusetts General Hospital are currently conducting research for a number of disorders using these drugs, and the FDA has granted breakthrough therapy designation for some psychedelics. We recommend future legislation to permit patients access to clinical trials and other therapy without the need to cross state state lines for care.
Representative Weber. I'm sorry, Representative Kofal, second.
She
was
before me.
Okay, sorry.
And I just wanted to say thank you to Representative Leon. We discussed this significantly earlier in the work session, and she's very succinctly expressed the concerns that we had not to stand in the way of appropriate medical treatment and to encourage medical treatment. But the concerns we had with the bill as presented was it was far too broad, created a whole new bureaucracy, and it was unclear how the supervision was going to happen and that it was going to happen in an appropriate setting. So we want to get out of the way of progress, but we don't want to set up a whole new bureaucracy. And I think that the statement does that.
Representative Kofal.
Yeah, I think that Representative Weber touched on what I wanted to say, which was that the original bill was modeled after cannabis legislation, and this is a completely different category of treatment. That what we are talking about is a situation in which the use of these substances is highly supervised, and I think is showing great effectiveness in the treatment of PTSD and other maladies. And so I just want people to be very, very clear that this is, to reiterate a point we brought up earlier, that this is entirely different from the kind of legislation that has made medical cannabis legal.
Representative Nagel.
Thank you, Mr. Chairman. I'm going to just demonstrate my hypocrisy and say that I really cannot stand the format of the way this bill was intended, like the other bill. However, I really greatly appreciate the way you wrote this up, and I will support that.
Other discussion? Seeing none, when the clerk is ready, motion is for recommend for future legislation on HB 1693 FN.
Representative Leon.
Yes.
Representative Lynn.
Yes.
Representative Kofal.
Yes.
Representative Mark McLean.
Yes.
Representative Seth King.
Yes.
Representative Mazur.
Yes.
Representative Nagel.
Yes.
Representative Popovich Muller.
Yes.
Representative Weber.
Yes.
Representative McKay. Representative Nutter Upham.
Yes.
Representative Shapiro.
Yes.
Representative Murphy, yes. Representative Tellez.
Yes.
And Representative McDonald.
Yes.
Motion passes 14-1.
Motion passes 14-1 on HB 1693 FN.
Good job.
Next up is HB 1706 FN, relative to notice required prior to circumcision procedure. Do I have a motion? Do I have a motion?
I'll make a motion.
Apparently, Representative Nagel.
Not for further legislation.
You move not to recommend for future legislation. Representative Murphy seconds. Representative Nagel, do you wish to speak to your motion?
I think we talked a lot about it this morning. I don't have a whole lot more to say. I do like the concept that this bill raised about looking at the whole concept of informed consent, which I think really needs to be done. However, the concept of requiring or putting in statute an informed consent for a single procedure on the basis of a relatively small percentage of Americans who feel that way, and we never did hear from the others, as we noted this morning, bothers me a lot, and therefore I really can't support this. It really interferes with medical practice, and I think it's a slippery slope.
Okay, other discussion? Representative Leon.
Thank you, Mr. Chairman. Representative Nagel, if you're going to write up the report, are you going to emphasize the informed consent for everything and not for the specific on this?
Yeah.
Okay, and then I can support that.
Yeah.
So thank you.
To me, that's a really important issue that I really was glad that this bill raised that. And the other bill that Representative Cushman brought up, those are critical bills to me. So yes, I will emphasize that.
Thank you.
Does that mean I'm writing it up?
Yes.
Yeah.
Please. Any other discussion? Seeing none, motion is to not recommend for future legislation on House Bill 1706 FM.
Representative Leon,
Yes.
Representative Lynn,
Yes.
Representative Kofalt,
No.
Representative McLean,
Yes.
Representative Seth King,
No.
Representative Mazur,
Yes.
Representative Nagel,
Yes.
Yes, Popovich Miller.
I was gonna say Representative Popovici Muller. If I'm butchering that, let me know. I've got 4 or 5 more to go.
You are doing great. Thank you.
Perfect, thank you. Is that a yes?
Yes.
Thank you. Representative Weber,
I too am a yes.
Representative McKay,
Yes.
Representative Nutter Upham,
Yes.
Representative Shapiro,
Yes.
Representative Murphy, yes. Representative Velez,
Yes.
and the chairman, Representative McDonald.
Yes.
It passes 13-2, recommendation not to have future legislation.
Motion to not recommend passes 13-2 on HB 1706. SB 400, relative to patient access to medical records. Do I have a motion? Representative McLean.
Thank you, Mr. Chair. I recommend for future legislation.
Okay, is there a second?
Second.
Representative Leon seconds. Representative McLean, do you wish to speak to your motion?
Yeah, thank you, Mr. Chair. I think, as I recall back to the testimony and the discussion at the time the bill was heard, everybody agreed that, the patients own their records. And I don't think it's fair that if, someone engages an agent because they're incapacitated, that they should be charged $4,000 as opposed to $6.50. However, being practical, if you went $6.50 across the board, the third-party agencies that do the work would basically go out of business. So we did try to an amendment to try to thread the needle. I don't think the amendment was able to settle in on the final solution, but I think the concept is good. And if we can find a way, to do that, I don't think we want to be punishing people that want access to their information, but would want to engage another party to assist them in doing that. So I would recommend for future legislation. Thank you.
Okay, thank you. Other discussion? Seeing no other discussion? Okay, the motion is to recommend for future legislation on SB 400. And the clerk is ready.
Representative Leon,
Yes.
Representative Lynn,
Yes.
Representative Kofalt,
Yes.
Representative McLean,
Yes.
Representative Seth King,
No.
Representative Mazur,
Yes.
Representative Nagel, Representative Popovici Muller,
Yes.
Representative Weber,
Yes.
Representative McKay,
Yes.
Representative Nutter Upham,
Yes.
Representative Shapiro,
Yes.
Representative Murphy, no. Representative Telez,
Yes.
Representative McDonald.
Yes.
Twelve to 3 passes.
Motion passes 12-3 to recommend SB 400 for future legislation. Next up is SB 458, relative to the dispensing of certain medications. Do I have a motion? Representative Nagel?
This is like the dating game. Remember that when the guy?
It's yours.
No.
Not to recommend, or, okay. Okay. So a second, Representative Leon seconds. Do you wish to speak to your motion?
A little bit. I'm the expert on this. I think, and our group is not here today. I was drawn by his committee report on this bill originally, where he felt that unless certain things happened, that he did not recommend further legislation as mine. I don't know if they have or they have not, but based on that alone, I think that I would rely on his judgment and say no.
Okay, Representative Leon.
Thank you, Mr. Chairman, and thank you, Representative Nagel. With that, reviewing that previous information, I would say that the current status is that it's not recommended for future legislation, but if we find that there's additional roadblocks with the Board of Pharmacy, then the situation would have changed. So as long as the Board of Pharmacy is moving ahead in order to find a way to accommodate these needs, there's no need for legislation.
Other discussion? And seeing no other discussion, the motion is against recommending for future legislation on SB 458. And when the clerk is ready, I'll ask him to call the roll.
Representative Leon,
Yes.
Representative Lynn,
Yes.
Representative Kofalt,
Yes.
Representative McLean,
Yes.
Representative Seth King,
Yes.
Representative Mazur,
Yes.
Representative Nagel,
Yes.
Representative Popovici Muller,
Yes.
Representative Weber,
Yes.
Representative McKay,
Yes.
Representative Nutter Upham, Representative Shapiro,
Yes.
Representative Murphy is a yes, and Representative Telez.
Yes.
I'll count anyway.
Representative McDonald.
McDonald, Representative McDonald.
Yes.
Yes. I'll count anyway now.
When I was a clerk, I always forgot the chairman.
15-0.
Motion passes 15-0 on Senate Bill 458, against recommending for future legislation. And the final bill of the day, SB 495, Representative McLean, I suspect you may want to make this motion.
Yes, Mr. Chair, I would recommend for future legislation.
Second.
Representative Barber seconds. Would you like to speak to your motion, Representative McLean?
And thank you, Mr. Chair. Let me just look at my notes. We did have a subcommittee and we did meet. I had a conversation with the new mayor of Manchester, and some of the most important legislation that we can address up here in Concord is that, relating to substance abuse treatment. Manchester is ground zero in many respects. And so, even though I'm a limited government person, and really believe in the market in a lot of areas, when people are coming out and they're looking for treatment to deal with substance abuse, it's not like going out and looking for someone, on Angie's List to fix the roof on your house. And in a conversation with the mayor, who himself is a recovered addict, he said, if someone comes out of Valley Street Jail clean, we have a rare chance to keep them that way. And if we send them to a place that's, the Wild West, and the counselor is not fully through their own recovery journey, then that opportunity is really lost. And so the subcommittee met, and we went through a lot of the concerns that were brought forth by the full committee. And we don't have the final language, but we did go through and develop a lot of what we think that final language should look like. And we're not really voting on that as much as the concept. But the language that we did agree on gets rid of the residential stuff. This is focusing on the outpatient, and it really is limiting the scope and getting rid of some of the concerns that people like Representative Merchant had, is just going to infringe on AA and things like that. So a lot of members of the full committee were saying, why not just let OPLC do this, since the individual practitioners, they're already licensed by OPLC. And the response back over and over again in the subcommittee hearings is that really we want to be understanding what is best practice in the facilities themselves. And that kind of led to the next question, is that going to choke off and maybe strangle innovation? But actually, when we spoke to people such as Granite Recovery that take Medicaid and they're already regulated. They're saying this is a very innovative field that is moving away from cookie cutter approaches to more targeted approaches, and that nothing within the Medicaid rule framework has stopped them from making, those innovations. And so they don't anticipate that any rules that we would be bringing forth with DHHS would do the same. The consensus seemed to be from the people who were testifying is that a larger barrier to innovation might be from the insurance companies, which are a little bit more conservative and are thinking, maybe we want to just be insuring stuff that's already out there and is already well established. But from a perspective of would these rules themselves impede innovation, I think the consensus was that not the case. The other thing we kind of asked was, why not just rely heavily on the ombudsman if we have abuses or things like that? Part of the bill brought forth the ombudsman provision, and we talked about some different examples, such as the right to know ombudsman. But the reason that the right to know ombudsman works is because there's already a set of rules that's there, which is RSA 91A. And so if you were to go to the RSA, to the right to know ombudsman and say, we're looking for a ruling on that. If you don't have the rules, then what do they refer to? So again, the rules kind of have to come first. So I think that, on balance, we don't have the final language, but I think this is something that's really important to people going into recovery. I think it's something that's really important to those of us who are in Manchester, who are at the center of this thing. And so what I would love to do is have the committee come forth with a recommendation for future legislation so that we can bring it back next year. Thank you, Mr. Chair.
Okay, thank you. Representative King and then Representative Profalt.
Thank you, Mr. Chair. I just want to thank Representative McLean for the work you did on this and being in touch with Mayor of Manchester. I initially was going to oppose recommending the bill, but based on everything you've just said now, including the fact that you shared my concerns with the original language of the bill, I'm going to follow your lead and support this. Thank you.
Thank you. Representative Profalt.
I'm going to vote against this. I am gravely concerned that this stands in the way of innovation. I understand that you've made some arguments that it does not. I think it stands in the way of innovation. I have serious concerns about the impact on AA and similar programs that, despite reassurances that this is not aimed at them, I think once we start down this path, that is where it goes. So I will be voting against.
Other discussion, Representative Leon.
Thank you, Mr. Chairman. I think that there's been some interesting viewpoints that have come up. I appreciate the work that you've done. I haven't been able to read the work that you put together, and just trying to look at this, trying to look at our impact within these. It looks to me, by counting votes, that there'll be the votes to pass it as recommended for future legislation, but then also recognizing the other concerns. I feel compelled personally to vote against the recommendation for future legislation, not because I don't want to see what you bring forward, and I do hope to see it filed, but so that there's not an overwhelming number of us all supporting it, giving it toward the mandate, because I am concerned about impacting the whole ecosystem of recovery, because drug abuse and recovery takes many paths. And I don't want to stop anybody from getting the treatment they need, while I also want to make sure that vulnerable people aren't taken advantage of. So, got to pick one way or the other, and I'm just going to try not to stack that, but I'm releasing anybody who's following my vote from following my vote on this one.
Representative Weber.
Thank you, and I just really want to second everything that Representative McLean said. We learned a lot in the subcommittee, and I was persuaded, I'm very much of the opinion that this is not an area where one size is going to fit all, and that we need to have a range of treatments, because some are going to be more effective for one person than for another person. But I was persuaded in the course of our discussion that we were not putting roadblocks in the way, but that we need to protect people who are at a vulnerable part of their life. So I come out in favor, and I just wanted to also pass along that I'm sure your ears were burning this morning because there were a lot of very complimentary remarks about your chairmanship of the committee and your approach to the process and your willingness to take it on. So we're all grateful for that, however we come out.
Other discussion? Seeing none, I'll ask the clerk to call the roll. Motion is to recommend for future legislation on Senate Bill 495.
Representative Leon.
No.
Representative Lynn.
Yes.
Representative Kofalt.
No.
Representative McLean.
Yes.
Representative Seth King.
Yes.
Representative Mazur.
No.
Representative Nagel.
Yes.
Representative Popovici Muller.
No.
Representative Weber.
Yes.
Representative McKay.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro.
Yes.
Representative Murphy is a yes. Representative Tellez.
Yes.
Representative McDonald.
Yes.
Eleven to 4 passes.
Motion passes 11-4 to recommend Senate Bill 495 for future legislation. That concludes the bills that were noticed for today. That concludes the bills, period. Representative Weber.
Mr. Chairman, before we leave, I just wanted to extend my thanks to all the members of the committee for all of the struggles we have faced together over the last 2 years. And I wanted to particularly thank you for the way you have run this committee. I believe that you have been very fair to everybody, and that when one is in a minority, it helps a lot to feel that you have been allowed to express your views thoroughly. And then if people vote against you, it's not a fun thing, but at least you feel like your views have been heard. So I very much appreciate your running of the committee, and I wanted to extend my thanks.
Thank you, Representative Weber. And I've also enjoyed working with everyone on the committee, and it's thanks to you, thanks to the Vice Chairman, Representative Leon. Our clerk, I forgot to thank him the last time we met, and he wasn't able to join us today, but Bill King, Representative Bill King from Milford, who was not running for re-election. I really appreciate his efforts and very much appreciate Representative Murphy and the numerous times he has filled in. For those of you who are not running again, and I don't know if there's anyone, well, Representative Shapiro, I know you're not. I don't know if there's anyone else here not running. Oh, I'm sorry. I guess I don't want to accept that. But anyway, good luck on your new adventures, and we'll see what the voters have to say for all of us. But again, thank you all very, very much. And before we close, any final comments? Seeing none, we stand adjourned.